Hello, and welcome to another episode of Healthy Mind, Body, and Spirit. Dr. Giavonne Rondo, and I'm so happy that you've joined us for another season of this show. I am so excited. This is episode 1, and we have an amazing guest who is an absolute expert at all things healthy for the mind, body, and the spirit. And not only is he an expert at mind, body, and spirit, but he is an expert on being on shows. So I'm going to introduce him. He is from Washington, D.C., the great Howard University, both for undergrad and medical school, HBCU all the way. He recently retired as a colon and rectal surgeon, just amazing. He is the host of Kentucky Health on KET and host of Centered on Health with Baptist Health on 84 WHAS. And he has interests that are just numerous, and we're going to talk about that. Welcome, Dr. Tuckson.
The pleasure is all mine for being here. And you may talk about me having a lot of interest. I'm just trying to keep up with you and looking at all the things you covered. In fact, you covered the whole waterfront as far as healthcare is concerned.
Well, we do like to cover a lot of different topics. The healthcare field is just, there's so many topics to go over, but particularly for our community, that's, really, I think what we both have, a lot in common about. So let's just get right to it.
Okay.
What is health? What is health in terms of the mind, body, and spirit for you, Dr. Tuckson?
Well, too often we think of health as being the absence of disease, but actually health is a sense of well-being. I don't want to say contentment because that kind of cheapens things, but it does kind of get to a thing when everything is in harmony, where our organ systems are working well. Our mind is clear and we can think and we can function and do all the things that we want to do. These are the things that make up health. And I think it's important that there's so many things that impact health. That some are in our control and some are not. But we need to try to optimize those whenever possible. But health is, again, it's not just the absence of, it is the being of self, being comfortable, being happy, and living our lives the way we want.
Wow. So you covered a lot of different things, and that covers not only the physical body, but it covers, it sounds like, the mind as well. And so we, want to talk about, those things and how what we can do to really help others to achieve just that. And so you talk, and one of your big interests is how can we go from a place of health for everyone and getting to the point of health equity for our community.
Yeah, and that's a key point. What does it take to be healthy? Well, we have to have a clean living space.
Okay.
We have to have a safe environment in which we live.
So now you're talking about the environment,
Yes.
just being outdoors. Okay.
So we're talking about, the absence of chemical toxins that are in the air, in the water, or in the ground and seep into the food in which we get. The air that we're breathing in, is it clean? Is it pure? Then we get to, can we exercise? Because exercise is very, very important.
Very.
Which is why I say where we live. Can we get out and walk even? Just something as simple as that. Then do we have access to food? And what about the quality of the food that we have, to which we have access? How are we preparing the food that we have? And then health, believe it or not, it does get into a little bit of wealth, because are we able to get employed to provide for ourselves in a meaningful manner?
And be able to afford those healthy foods.
Again, and I'm not talking about one has to be mega rich and all that sort of thing. Yeah, but when we talk about things like living wage, well, living wage means, can I have enough income to buy the things to sustain me and my family, keep that level playing field for us? So that's the next thing. And then they have education, because we have to be aware and understand what does it take to keep us healthy, and how can we partner with our healthcare providers to also help them help us. So education plays. So all these things kind of interact. And of course, if we were talking about wealth, we would be sitting here talking about how education is important to wealth.
Right.
But we're talking about health. So I'm talking about how all those things converge as far as making us a healthier individual, or helping us keep our health.
And that's very holistic. I've never heard, my own doctor talk about all those things, education, talking about economics, talking about all those different things that play a role in your health. So you're talking about a very truly holistic,
Sure.
mindset when it comes to just health and wellness overall. But how do we really, how do we achieve that? How do we put that forth for all of our communities? Because as we know, like we're in a community right now where we're filming this show where the air quality is completely different than it is in, let's see, the eastern portion
Sure.
of our city. And there's so many different factors, like going out here and exercising
Sure.
outside of this area. It's not going to be as optimal as it would be in other areas where it's just really a different socioeconomic, we just have to be honest, just environment overall. So what can we do?
Well, I think it's important, number one, we have to, number one, validate each other's existence and respect each other. Too often we don't. Let's look at the great example that COVID-19 provided us.
Yes.
COVID was a lot of bad things, but it showed us a couple things. So we had one group of people who were able to go home and work from wherever it was that they lived, because they had those kinds of jobs where they could either be online. They didn't have to come out and interact in the community, yet they were still able to do the jobs that they were doing and still receiving paychecks on a regular basis. They, for the most part, did not have much disruption in their lifestyle. Maybe they couldn't go to the theater, maybe they couldn't go to a restaurant. But as far as everything else, everything was going fine. Then you had another group of people, and let's look at the meat packers. The meat packers, individuals who were having to slaughter the meat, package it, shipped off. They were mandated that they had to go to work. And in the course of being mandated to do so, they were not provided with personal protective equipment. They were not allowed to take sick days off. If they were ill, they had to come back in. If there were family members at their home, they had to still come in. In fact, there was legislation that was pushed that said if they were mandated. So they used this term called essential workers, which was the most absurd term that ever came about. It was a disgrace to call these people essential workers, because what effectively we were doing, you had one subset of our community was saying, I want you to take all of the risk to maintain my lifestyle. I want to have steak, therefore I need you down there. So what was the overall impact of this? You realize the highest mortality rate from COVID came from individuals working in the meatpacking plants? If you lived in a community with a meatpacking plant, just lived in the community, you had a 5-time greater risk of getting COVID and being hospitalized. And if you lived in an area where they were doing chicken farming, you had a 2-time risk.
Wow.
Yes. So this is what I say. We don't respect our other individuals. We don't validate other people. Too often we're looking at what is in this for me.
Yes.
And this is how we get some of the healthcare policies that we have right now. It is it's a win-lose thing. If I give in to something for you, I lose, rather than all of us accepting, if I help you, you can help me. Look at Medicaid for everybody. Yeah, it has a cost up front, but the savings down the road, we call that an investment. We want to invest in roads, we want to invest in people. This is the thing which we sometimes don't want to do. Wow.
So, needless to say, you would be a proponent for universal health care?
Yes, absolutely. And as you know, within our profession, there are some who have looked at universal health care and they said, I don't want the government telling me how to practice medicine. Well, let's face it. I don't know how you are in yours, but I know with looking at Medicare, I know when I submit a bill with Medicare, I know what I'm going to get paid per service with Medicare. But when you deal with the private health insurers, you talk about somebody interfering with the quality of how we practice medicine. How many times have you had to go in and call to try to get authorization for a particular medication and continue to do that, or get told, we're not going to cover this service, but we will cover this?
All the time. All the time now.
Yeah. These private insurers, some I think mean well. Some I think it is malicious. In the back of my mind, I think most of it is, but I'm going to give them the benefit of the doubt. But, you know, these groups have a greater impact on the health care that we deliver than the government. So I would much rather have a universal plan where everybody is covered. You know, as you know it, United States ranks 36 in the world in terms of health care between 0 and 65. After 65, we're number 1.
Because of Medicare.
Because of Medicare.
Wow.
All of a sudden, you've got people
Wow.
who are getting
Equal.
health care coverage.
Yeah.
So they're on an equal setting.
Yeah.
So they can go in and see a physician on a regular basis if they need to. They can get to the hospital. So, yeah, I'm a big proponent of universal health care. I think we are the only industrialized country that doesn't do it. This doesn't mean that you can't still go. If you want to have a private, you're a physician,
Yep.
I'm a physician.
Yep.
People have this perception that we have all kinds of money. I don't hate to break it to you, but it ain't. We're doing well, obviously. But but if you're fortunate enough to want to have your own private insurance instead, go right ahead. That's what happens in England. They have the National Health Service. And if you want to see somebody on a private basis, you can do that if you so choose. But making sure that everybody gets access to health care, simple thing. That's what we need to do.
Okay. So that will help to kind of, I wouldn't say level the playing field, but just making it more equitable in terms of having Medicare, not just expanding, the opportunity for everyone to have universal health coverage overall. And then, so what are some other things besides that? Like if I'm looking at, just health overall, what kinds of things can I do to help my own health? And what are some things that are beyond my control as well? And we talked about that a little bit.
Yeah, and let me look at one other thing, if I may. One of the things that you do is try to make sure that folks, in this case, folk who look like you, talk like you, walk, think, and breathe like you, have access to someone like you.
Yes.
So even though we may talk about a universal health care in which a service will be covered, do we have access to healthcare workers? Do we have access to quality healthcare workers?
Yes.
And so
that look like us.
Yeah. Or I want somebody who's just going, to be quite frank, I want somebody who's going to treat me right. Now, too often, there used to be a TV show called Cheers, and the tagline on that where everybody knows your name.
Yes.
Well, yeah, you want that. You want to walk in the office and say, hey, Tuckson, how you doing, man? Okay, I know how your wife, your son, and everybody else is doing. You don't want to keep coming in every day. You got to reintroduce yourself. Well, this person has no concept of your lived experience.
They have said that trust is a social determinant of health, so that who you trust determines your health. So of course, if you can go to someone who you actually trust and can really confide in them, and you take their advice, then you potentially your health is influenced by that.
Well, I like to think that if I'm going to your office to talk about something, the one thing, again, because you understand my lived experience, and so whatever bias you have against folks that look like me, that's not being brought into the room, or you're not having to spend the first 2 minutes of our conversation saying, this is a nice person, this is a nice person, this is not a thug, this is not a hoodlum, this is not somebody trying to game me for drugs. This, you're just sitting there go, okay, tell me what your problem is. So there is this perception that an immediate connection is made. Just like if you, as a female in a room, and I walk in as a male, you can't, boy, I sure wish it was a woman. I was a colorectal surgeon, so I had to look at a lot of sensitive areas. And my patients understood. But I do know that they probably would have felt more comfortable had I been a woman. Just like sometimes as a guy, you might, even though you're a doc, some things I might want to talk to you about that I want to talk over with a guy. But I know I can talk to you, but it just, so yeah, trust is so very, very important. And unfortunately, sometimes, even to this day, African Americans, when they walk into a healthcare setting, physician's office, clinic, or the hospital, we're not treated the same. So we always got to ask the question, am I being treated this way? Do I come in with a chip on my shoulder, or am I coming in with the memory of past experiences? And that doesn't impact how we do.
It absolutely does. And so that leads me into, just the other topic in terms of how do we improve the access and improve just in terms of the health equity, like more African-American physicians, nurses, nurse practitioners, physician's assistants. Because from what I understand, some of my reading suggests that you're more likely to not only trust, but also get better health care from someone who really understands you and your values and your background. So how do we achieve that? What do we need to do?
Well, let's look at the numbers. If you go back to the early 70s, late 60s, 5% of physicians in America are African American. What are they right now? 5% African American.
Yep.
Now, what's interesting is that if you look at the number of women, that number is going up. Men, brothers are going down. So, but unfortunately, we're still at about 5%. So how do we improve upon this? Well, we talked about education as being one of the determinants of good quality health. And here's how that plays in. If our kids aren't getting proper education in the elementary school level, they're going to come into junior high school a little bit behind. They're not able to catch up in junior high school. Can't do it in high school. In college, they're going to be behind. And when it comes down to competing for spots to get into medical school, they're not going to be prepared. They can't go there. One of the best things that we're seeing, I think they're seeing it down there at that alma mater of yours, Spelman, just as you're seeing across the street there at Morehouse, but also at Howard. We're getting more African-American kids coming in who've got a stronger background in the STEM, science, technology, engineering, mathematics.
Because of that focus.
So we're trying to, so if we're trying to increase the number of black docs, we've got to go back and look at what are we doing at the preschool, elementary school level, where we're getting these kids to like learning. And I think black kids like learning just as much as anybody else. They have to be in a position where they can concentrate on learning. They don't have to worry about, like in Chicago, a kid has to worry about the moment I walk out this door, whose turf am I going to cross over, and is my life going to be in danger? Or, you know,
especially as a male.
Oh yeah.
Yes, especially. Yeah.
And then, unfortunately, for our women, you know, how are the women being treated? Do they have to worry about being accosted? How they're being perceived? Okay. So so we have to look at improving or stemming things up, or supporting things rather, in the STEMs, in education. That is one way we're going to have more, because as we look at everything that's going on right now in terms of what is getting at the national and state level, are trying to crush education for African Americans. This is not a conspiracy. This is not me being paranoid. Let's just look around. There's this pseudo argument about affirmative action.
Yes, and that's coming up recently. Just this week.
And that's what's going on. And so these people are just talking about there's so like you go through 400 years of slavery. And then you go, let's go, slavery. Then you have the golden period where you had Reconstruction for those 12 years.
That was just 12 years,
just wonderful. But then all of a sudden you got Jim Crow.
Yes.
Jim Crow doesn't die out to 1953 as a formal thing. And even then you go to 63 and 64.
There's still the repercussions of that though.
All this. And so we're saying, so then you look at, well, why aren't we in getting good education, good schools? Well, because we've been zoned out of those places where quality education is. When we had the desegregation of the schools, you had segregation schools that showed up in the South and in the North, where all the white parents said, fine, if you're going to make African-American kids come into my public school, we'll create our own. And so no money is going in. So now we look at how this charter, we're being sold this bill of goods on charters schools as being something that's going to be a benefit for us. Come on. There are not going to be that many schools. Let's put the money in. So education is one of the key things that I think we have to look at. That is one thing we're going to do, so that our kids can go on and get into the Spelmans and the Morehouses and Howards and other places in the world, so they can then get into the medical schools in the country.
And I think, just to piggyback on the point that you made earlier about valuing, each other and valuing people, we need to continue that whole value system at a young age. I mean, when someone is born, just valuing them and putting into their heads early that, okay, yes, you can be whatever you want to be. And it's not just a basketball player or a model or a sports, star, but you can actually, use some other, faculties that you have, like your mind, and be physicians, lawyers, and other professionals as well.
Sure.
And not to say that, working in other industries can't be wonderful types of things, but regardless of what you do, you are valuable, regardless. But starting at young ages with, people knowing that they can actually be, physicians, they can actually be nurses, they can actually do these great things that are outside of the realm of what they normally are being fed on a regular basis through social media and through just TV and through just, our world that, really kind of focuses on the sports and the celebrities or whatnot. So
can I say this one other thing about that? Yes. It's interesting. There was an interesting study that was done where it looked at women who got prenatal care versus no prenatal care. So what this entailed was getting prenatal care care through the pregnancy, and postnatal, after the birth took place. And this included regular, making sure that the kid and the mother were getting food and all that, all the way up through kindergarten. And then you compared it to a group that didn't get. What they find out? Number one, the number of those children that got involved in the criminal justice system dropped dramatically.
From prenatal care?
Just from having prenatal care,
Wow.
pregnancy, and postnatal care, and getting food and supplements and all that sort of thing. Because there was regular attention that went to this versus the children that did not get that. So what are the things we look at that's being cut right now? We're looking at food programs post-pregnancy, and food programs in the schools are being cut. So where at least you knew the kid was going to get a good meal, these things are being cut. And we wonder, why isn't the kid paying attention? Why aren't they doing well? And that was something that showed. And that's a minimal investment. Minimal investment. They got a maximum benefit.
And when it all boils down to it, it's all about caring. You know, it's all about caring. And when we're talking about healthy mind, body, and spirit, I think that's, you know, what it all boils down to is truly caring. So, Dr. Tuckson, this has been an amazing show. I haven't even been able to ask you even a few of the questions that I meant to ask. So we're going to probably have to do part 2. Thank you so much for coming.
Thank you.
Just amazing, amazing resource for our community. Thank you so much. We're going to have part 2. Thank you for joining us for this very first episode for season 4 of the Healthy Mind, Body, and Spirit with Dr. Giavonne Rondo. Thank you for joining me. Have a great day.